Recurring vaginal infections can be frustrating, uncomfortable, and sometimes even distressing. Many women experience repeated bouts of symptoms like itching, unusual discharge, burning, or irritation, only to find that the problem returns again and again, despite following recommended treatments. If you're one of those women, you're not alone. And understanding why these infections can be so stubborn is the first step toward breaking the cycle. The human body is a complex ecosystem, and the vagina is no exception. It's home to a delicate balance of bacteria and yeast that work together to maintain a healthy environment. When this balance is disrupted, infections like bacterial vaginosis or yeast infections can develop. Unfortunately, for some, these infections don't just go away after a single course of medication. Instead, they come back, sometimes within weeks, sometimes after months. Let's explore 3 of the most common reasons why vaginal infections keep returning, and what you can do to finally get relief. First, one of the most overlooked reasons for recurring vaginal infections is incomplete or incorrect treatment. When you experience symptoms of an infection, it's tempting to reach for over-the-counter remedies, especially if you've had similar symptoms before. While these treatments can be effective, they're not a one-size-fits-all solution. Different infections require different medications, and self-diagnosis isn't always accurate. For example, the symptoms of a yeast infection and bacterial vaginosis can be remarkably similar. Both can cause itching, irritation, and unusual discharge. But the treatments are entirely different. Using the wrong medication can not only fail to clear up the infection, but may actually make it worse, or at least leave the root cause unaddressed. Additionally, even when the correct medication is used, it's crucial to complete the entire course of treatment as prescribed, even if symptoms improve before you're finished. Stopping treatment early can allow some of the offending microbes to survive and multiply, leading to another outbreak. In some cases, infections may be caused by strains of bacteria or yeast that are resistant to standard treatments. This can result in a cycle of temporary relief, followed by recurring symptoms. If you find that over-the-counter treatments aren't working, or if you've already tried several courses of medication without lasting success, it's time to consult a healthcare professional. They can conduct tests to accurately identify the type of infection and recommend a tailored treatment plan, possibly including prescription-strength medications or even combination therapies. The second major reason for recurring vaginal infections is a disruption of the vaginal microbiome. The vagina relies on a healthy balance of beneficial bacteria, especially one called lactobacillus, to keep harmful microbes in check. When this balance is disturbed, it creates an environment where infections can thrive. Several factors can contribute to this disruption. One common culprit is the use of antibiotics for unrelated health issues, such as a sinus infection or urinary tract infection. While antibiotics are effective at killing harmful bacteria, they can also wipe out the good bacteria in the vagina, leaving you more susceptible to infections like yeast overgrowth or bacterial vaginosis. Hygiene practices and lifestyle choices can also play a significant role in upsetting the vaginal microbiome. Douching, for example, is often marketed as a way to feel clean, but it can actually strip away the protective bacteria that keep your vagina healthy. Similarly, the use of scented soaps, bubble baths, and even certain laundry detergents can cause irritation and disrupt the natural balance. Wearing tight, non-breathable clothing, like synthetic underwear or workout leggings, can trap moisture and warmth, creating the perfect environment for yeast and bacteria to grow. Hormonal changes, such as those that occur during menstruation, pregnancy, or menopause, can also impact the vaginal ecosystem. Fluctuations in estrogen levels, for instance, can affect the thickness of the vaginal lining and the acidity of the environment, making it easier for infections to take hold. Even stress and diet can influence the health of your vaginal microbiome. A diet high in sugar, for example, can promote yeast growth, while chronic stress can weaken your immune system, reducing your body's ability to fight off pathogens. Restoring and maintaining a healthy vaginal microbiome requires a combination of strategies. Consider switching to unscented, gentle personal care products and avoid douching altogether. Wear breathable cotton underwear and change out of wet clothing promptly. If you must take antibiotics, ask your healthcare provider about ways to support your vaginal health during and after treatment. Sometimes, probiotics or specific vaginal preparations can help. Paying attention to your diet and managing stress levels can also make a meaningful difference. The third reason for persistent vaginal infections is the presence of external reinfection sources or underlying health conditions that haven't been addressed. Sometimes the source of a recurring infection isn't just within your own body. It could be coming from your environment, your partner, or your overall health. For example, if you're in a sexual relationship, your partner could be carrying bacteria or yeast without showing any symptoms themselves. This means that even after you're treated, re-exposure during sexual activity can trigger another infection. In the case of yeast infections, some men can carry yeast on the skin of the penis, and in heterosexual couples, treating both partners simultaneously can reduce the risk of reinfection. For bacterial vaginosis, while it's not technically classified as a sexually transmitted infection, sexual activity can influence the balance of bacteria in the vagina, and having new or multiple partners can increase the risk of recurrence. Shared personal items, such as towels, underwear, or even sex toys, can also serve as reservoirs for microbes. Ensuring that these items are kept clean, not shared, and properly sanitized can help prevent reinfection. Using condoms during sexual activity can also offer a layer of protection, both by reducing the transfer of microbes and by protecting the delicate vaginal tissues from irritation. Beyond external sources, certain health conditions can make you more prone to infections that keep coming back. For example, diabetes, especially if it's poorly controlled, can lead to higher levels of sugar in the urine and vaginal fluids, creating an environment where yeast can flourish. Immune system disorders, whether from chronic illnesses or medications that suppress immune function, can also make it harder for your body to fight off infections. Hormonal imbalances, such as those caused by birth control methods or menopause, can alter the vaginal environment in ways that promote infection. If you have a chronic health condition, working with your healthcare provider to optimize your overall health is an important part of preventing recurrent infections. Managing blood sugar levels, reviewing your medications, and discussing alternative birth control methods, if needed, can all contribute to better vaginal health. So, what can you do if you're struggling with recurring vaginal infections? First and foremost, seek medical advice. Persistent infections deserve a thorough evaluation, which may include lab tests to accurately identify the cause. Don't be embarrassed to talk openly with your healthcare provider about your symptoms, lifestyle, and concerns. They're there to help, not to judge. Bring a list of all medications, supplements, and personal care products you use, as these can provide important clues. In addition, consider making small but meaningful changes to your daily routine. Choose gentle, fragrance-free products and keep the vaginal area clean and dry. Avoid unnecessary antibiotic use and ask about probiotics if you're prescribed antibiotics for another condition. Maintain a healthy diet, manage stress, and stay active. If you're in a relationship, talk with your partner about your symptoms and consider whether they should be evaluated or treated as well. Ultimately, breaking the cycle of recurrent vaginal infections often requires a combination of the right medical treatment, lifestyle adjustments, and attention to your overall health. By understanding the most common reasons behind these persistent problems, incomplete or incorrect treatment, disruption of the vaginal microbiome, and external or underlying health factors, you can take proactive steps toward lasting relief and greater comfort. Remember, you deserve to feel healthy and confident in your body, and support is available. Don't hesitate to reach out for help and take charge of your vaginal health today.